Hello, and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and the owner of Ascend Health Center. And I have with me today Dr. Stephen Carp from Carp Cosmetic Surgery Center.
Good afternoon.
And this is going to be really fun because I work for Dr. Carp sometimes. So, maybe I'll get fired at the end of this, maybe I won't. Who's to say?
Well, if you haven't by now, you're probably in pretty good shape.
Yeah, that's a good point. So you own a plastic surgery place, and the intersection between plastic surgery and mental health has always been fascinating to me. Because on the one hand, it's like, well, people aren't feeling good about themselves, so they go get plastic surgery. But the other hand, you could say that, well, people are finally feeling better about themselves, so they're investing into themselves and getting some plastic surgery.
It's a combination of all of that. And certainly from our standpoint, while we're not mental health providers, we do have to be kind of on the alert in part of our screening and consultation process to look for people that, helping people with their self-esteem is one thing, but making sure we're not offering services to people that are expecting something life-changing that isn't from their physical appearance and needs to be addressed in other ways.
So basically are people having an accurate perception of who they are, what they look like, what they're going to.
Absolutely. We, probably the number one thing that we look for is any signs of body dysmorphic syndrome, and an individual that has that that's really an absolute contraindication to having any sort of plastic surgery in general.
Right, and I think we've talked too about different lawsuits just because it's a fun conversation in the OR, and sometimes those do reveal like, okay, in this case, they should have done more to watch out for this, or in this case, this person was never qualified and you shouldn't expect them to have the expertise to diagnose something like that.
Well, absolutely. And, every specialty has its kind of standard of care of what should be part of it, what you screen, what you shouldn't screen. And from the mental health side of it, certainly it's something we look for. And I certainly have had patients that I've told them, before we proceed, I want you to see somebody, operate on a lot of people that have are seeing some sort of mental health provider, psychiatrist, psychologist, whatever it might be, and they're under care, and doesn't mean that they can't have cosmetic surgery, and most of them can, but in many cases I'll still ask them to get kind of a clearance from their provider.
Right, and I think that's an important point, that just because you're undergoing mental health care doesn't mean you're excluded. It's sort of like when you see some horrific crime on TV and then they start talking about mental health issues. And it's like, well, that's kind of insulting to people with mental health issues, because often it says, nope, that was an evil person. It's not any more complex than that.
Sure. There's not sometimes the lines are very ambiguous, but sometimes they're very clear. So
for sure. Okay. So when is plastic surgery? You've already said a little bit of when it's a bad idea, but is there anything specific? Now, usually when I work with you, we'll have somebody who's came to you 3 years ago, was like, well, that worked really well for me, and then they'll come back another 1 or 2 years and they'll get a tummy tuck where before they got a breast augmentation.
Sure. In general, there's almost an evolution in patients that first, when they're younger, do I want to do it? Do I want to invest in it? I'm afraid to have surgery. And then they, for whatever reason, something finally pushes them to do it. We kind of have a saying, people probably pick up the phone 10 times before they actually make the call for plastic surgery. But once they do it and they get a comfort level with the safety, what the experience is, having them come back as down the road as a repeat patient is not at all uncommon. And it doesn't mean you hear people say, oh, you become addicted to it. It's not about that at all. Obviously, there was probably a very, very small percentage of people that is the case, that probably do need some sort of mental health guidance, but in general, it's just people become comfortable with it. And I always tell people, there's really no difference between making a decision to have cosmetic surgery versus having your hair done, buying different clothes. It's just a degree, and you have to be comfortable with it and understand what those things can and can't do.
Right, and that's something that you said too, that sometimes people spend a lot of money on their nails or their hair, but a lot of times with some of the simpler procedures you do, it actually makes a bigger difference for a longer amount of time too.
No, absolutely. The patients that come in that are been struggling with looking in the mirror, and when I say struggling, I don't mean that they don't go out, they're home ridden because they don't want to be seen, but they finally make that decision for whatever reason. Sometimes it's just financially they couldn't do it, now they can, but they make that decision, go through with it, and then afterwards, probably the most common thing I hear is, why did I wait so long?
So again, what you're saying is somebody who's like alone at home and really worried about the way they look, that's probably not a good step of like, hey, let's just go get plastic surgery and then everything will be fixed. But if people are already starting to work on their appearance, or one thing is, this is a little awkward, but in the business world, it actually helps a woman get promoted if she looks better. Well, there's studies that come out every few months about, and again, it's an awkward topic, but
absolutely. Well, but not
the show
really.
is nothing if not awkward.
Yeah,
so.
but it's absolutely that's true, and it's really not awkward because what we're seeing is as our population is aging, and both men and women in their 50s plus still having to work and compete for jobs, that's one of the reasons we're seeing a rise in men undergoing cosmetic procedures for that exact reason.
Yeah, and I think I've seen that several times at the clinic where it's like, well, I'm working with a bunch of 30-year-olds and I can't look out of place. Like, I have to look like my mind is sharp, and maybe it's not fair, but I think there was one patient who actually like put, look, I can spend this amount of money on this type of training, or I can do this, and they'll both equal the same results for my job.
Well, and that's probably true for some people in certain jobs, absolutely.
Yeah, but I think, and this is something we talk about on the show a lot, what really helps is just having a knowledge of what the truth is. A lot of times, especially in mental health, we'll see a lot of positive affirmations and a lot of, oh, you're doing such a great job. And sometimes what people really need is just somebody to speak the truth to them, whether it's good or bad, just some honesty, as opposed to this sense of self that's so far off base.
Well, that's absolutely true. And one of the things that I discuss with patients, first of all, is, and most importantly, is just that. You have to really be honest and upfront of what it is you can do for them, and try to get a sense of, will that meet their expectations, and be clear to them that these are the goals for what we're trying to achieve. And if that fits what you're trying to do, then you're a candidate. But it really is incumbent upon us to kind of pull some of that information, but then also give it back to the patient. The way I look at it is without fluff. And I mean, I know I have patients and have had consults in my office, patients come in and kind of a little bit of a clash of personalities, simply because I'm very direct with patients with saying, this is what you're asking about, this is what your options are, or I don't think there's a good option and I don't think you're a great candidate. And sometimes patients don't want to hear that, but I think it's important. The worst thing I think we can do is take patients down a road that they're never going to be happy.
Right. And that's why I thought this would be such a fun show, is because you're one of the most direct people I've met, and you think of plastic surgery as something like superficial and aesthetic, and, oh, we're going to make you look beautiful, but instead it's like, here's what we can do, here's what we can't do, so a lot of it you're saying is in the patient education.
Absolutely. If you don't spend the time with patients first finding out what it is that they're looking to do, what bothers them, and then spend the time going over what their options are, what to expect, which includes risks, that's where you end up with patients that aren't happy. And I'll see that, and I hope it's my patients don't go elsewhere for second consults or second opinion, and it happens too. But I certainly see patients in my office that have had either consults or have actually had surgery. They're not happy with it, and when I talk to them, it's the impression I get is they weren't given all the information, their expectations were not real, or the results couldn't meet their expectations.
Right. And are they surprised when you take that time to walk them through that education?
I think that they're more, I wouldn't say surprised as much as it gives them a very good experience and a level of confidence that, hey, somebody's spending the time with me, I'm not just a number.
Right.
And the way I've run my practice really since day one, I'm in solo practice, it's just me, I have my nursing staff, is that we have a very small group of people that know how I do things, and so there's ideally never any conflict of information given to patients that contradict each other, but that they can sit and talk, whether it's to me, whether it's to Jessica, my aesthetic coordinator, or one of my nurses, and feel comfortable that the information they're getting is important, number one, and honest and truthful.
Right, and I've run that into those patients where they'll ask something, and I'll say, well, let's look at what this discharge summary says, or let's look at what this paperwork says, so that we're on the same page.
Absolutely.
I've seen that a lot in mental health, where, well, the nurse practitioner said this, and then you said that, And a lot of times it's like, well, let's make sure we're on the same page.
Sure.
And let's make sure we all have the same expectations.
And sometimes it's not that it's different information, but how it's said just comes across different.
Right.
And in my days when I would do most of my procedures in a hospital setting, our staff and myself would spend time with the patient discussing post-op care, things like that. And then they go to the hospital, and somebody at the hospital would say, well, here's information from us, and now the patient has no idea. And of course, it's not even no idea what to believe, but who to trust now.
Right.
You would hope that they trust your surgeon more, but sometimes they listen to somebody else, and I've had situations where that actually can get a patient have some problems because of that.
Right. If they're not sure, wait, who do I reach out to? Is this a big issue? Is this not? And it's really something that every specialty should have of what's our expectations, why. What I started at Ascend is I'll actually have a piece of paper with the patient, and together we'll write out what we expect, because similar to electronic consent forms, there's some things that if they're digital, we'll go through the motions. It's just what we all do as people. But for whatever reason, the physical writing down, like, are we looking to have a complete remission of depression? Are we looking to, dedicate an hour a week or get by at my job, or I want 1 or 2 less antidepressants? And it's not something that's usual for healthcare. People are like, oh, I want to get better. But I think when we define what exactly is that we're looking for.
Sure. And I'll have patients come in and sit down and go, and I know on the schedule they made an appointment, let's say for breast augmentation. And I walk in the room and I'll sit down and say, so what is it that you're trying to address? What bothers you? Not, so you're here for breast augmentation. Because I think that's a very different way of thinking of things. And when you do it that way, then they start saying things that maybe they wouldn't have brought up before. And the same thing with somebody that comes in, that's older, maybe and is addressing facial aging, and they'll say, well, what do you think? What would you do? And my answer is no, it's what bothers you? Prioritize. What's the number one thing when you look in the mirror that you see? What's number 2? And what do you expect to see different if you go through with any sort of treatment?
Right. So previously on the show, we were talking about group therapy, because shameless plug, we're going to start that in a few weeks at Ascend. You're all welcome to come. It's $50 each time though. So we're starting group therapy, and what we realize is the way it works is you actually have a sounding board. It's not your family that sometimes can be both the cause of your distress and sometimes part of the healing. It's actually people getting together and being a sounding board of, okay, here's what we want, or here's what we think of the situation. So what you're saying is, instead of just, oh, I don't like how this looks, I need it fixed. It's like, well, let's address the deeper reason of what is it. And sometimes that probably means that the patient doesn't get surgery, because when they say it out loud, they're like, well, that was dumb. I'm not doing this. And that's best for everyone.
Well, also, it's an opportunity where, because people get so many misconceptions today with Instagram, all the social media of what can and can't be done and what to expect, and they'll come in and think, well, I just want to look younger. And I've had patients say, I want the procedure that Kylie Jenner had. And you look at them and say, well, I don't know, first of all, what specific procedure you're talking about, number one, but number 2 is, that might be fine for that person, but that doesn't mean it applies to you. So what is it that really bothers you? And you got to start from there.
Right. So do you see this, like, everyone craving to just be younger, like the way that in our culture?
It's not so much younger. I don't think it's being younger. I think it's looking better, looking healthier. Now with, again, the crazes that we've had in the last 5 years with social media, we're actually starting to see a little pullback on some of that stuff. All these people that were over-injecting their lips, their butts, all these things, we're starting to see a little pullback, because people are starting to go, wait a minute, that doesn't look like me, that doesn't look real. And of course, once the celebrities start pushing it one way or the other, you see that trend.
Sure. So you're saying too, there's a balance between, like, I had this conference of how I look, as opposed to, oh wait, I look ridiculous. So it's really confidence versus self-esteem versus mental health, like all those are kind of rolled up into one.
Absolutely, and we shouldn't be making people look odd. We should be enhancing, but we shouldn't be taking something that's normal and making it look abnormal. There's a difference there. There's a huge difference, and we've certainly seen that as plastic surgery, cosmetic surgery has become such a kind of normal thing now, where people are not just pushing the envelope, they're crossing that line completely. And I'm not even talking, you could talk about like things like Michael Jackson, et cetera, but just the average person who is going out, might be, some 20 or 30-year-old who, spends a lot of money every 3 to 6 months on injectable products, and they keep doing it and keep doing it, and to the point where now they took a normal structure, normal lips, whatever it might be, that they wanted hands, filled some, and now they don't look right.
Right. Yeah, because everything has a risk.
Right.
Whether it's mental health, plastic surgery, there's always a risk benefit. And that's kind of what we've been saying about education and informed consent of, here's what we can do, here's the risks of it, and is it worth it?
Sure.
So,
and that's why going to somebody that's well trained, and being well trained isn't just I learned how to do a technique. It's understanding who it applies to, when it applies, what are the risks, what are the complications, how do you handle the complications, do you know how, and how do you avoid somebody going, wow, that doesn't look like me anymore.
Right. Well, part of that is, are they board certified the way you are in plastic surgery, the way our psychiatrist at Ascend is in psychiatry and neurology? But what other ways can patients tell, like, oh, this is a reputable place with experts, or oops, they're going to take my money?
Well, first thing, from a plastic surgeon standpoint, as you said, I'm board certified. There's basically a handful of boards that historically are the ones that through the right training process have said, and then testing said, okay, you are a certified physician in this particular board of medicine, cardiology, and plastic surgery being one of those. So do your homework. Make sure they're certified by the American Board of Plastic Surgery. There's some other boards out there that aren't part of that you might hear about, a board of cosmetic surgery, which is not part of us. So that's where it starts, number one. And then number two is, find out, what's their experience in a particular procedure. If they're not a plastic surgeon, there's a lot of other non-plastic surgeon, for example, injectors out there doing Botox, Restylane, all the injectable products.
Right.
What's their experience? How did they train? Where did they train for? What experience did they get? If they have a complication, do they have the right tools, drugs to manage the complication? Will they even recognize the complication? And certainly, the way I kind of see this is, if I look at the things that I receive literature, that the amount of information for programs to train people, I don't want to just say surgeons, but nurse injectors, family doctors, ER doctors, anybody else doing this stuff, the programs that are going skyrocketing in terms of teaching people how to manage complications, says that there's a lot more complications. But you got to ask the right questions.
Yeah, and that makes a lot of sense, because I get pamphlets in the mail all the time, and I've even had, I think at one point there was a chiropractor trying to convince me to do like PRP injections, and I was like, I don't really have the personality for it. I was like, let's go to Dr. Carp or someone like that. And that's part of it too. Like, are we looking for, my anesthesia style is, let's get this compilation of drugs and together we'll make something that works for you individually. But that idea on someone's face is a terrible idea.
Sure. And we're seeing what, the best way to describe it is scope of practice creeping, meaning you trained as a plastic surgeon, you do plastic surgery. You trained as a gynecologist, you do gynecologic surgery. What we're seeing is people creeping away from that into the aesthetic world with weekend courses, things like that. Right. And even the American Medical Association now has it as kind of one of their things that they're looking at and how to address. And that right there should tell you that this creeping into other specialties is creating problems. Because the public, unless you do your homework, it can be hard to really ascertain, gee, is that the right person? And especially if you're a price shopper. Because to me, healthcare is not the place to be shopping for price. You go to the place that you feel most comfortable and confident with based on that person's experience, not price.
Right. And that is one of the interesting things about plastic surgery, is it being a self-pay model, because for all the ills that you just mentioned, at least you know what you're getting. Most other branches of healthcare, it's like, well, I hope this works out, and patients aren't really ever thinking, is this worth the money I'm paying? Because they don't know what money they'll end up paying. You can have explanations of benefits or estimations, but it's still very vague of what you're getting for what you're paying. Well,
with the implementation now of the requirement for giving good faith estimates, that's changing, but it's certainly from the aesthetic side of it. For cosmetic plastic surgery, we've been doing that forever. You get a consultation, here's your bill, here's a quote, this is what you're going to pay. And it's starting to happen where we're seeing it because it's been mandated by federal law.
Right.
That's happened. So.
And it's mostly because of my people. Anesthesia is a big reason of us purposely staying out of contracts so we could bill. And it's not a world where anyone's innocent.
Sure.
It's certainly one where it is much better, like, here's what I'm paying and here's what I'm getting, like any other economic decision. But somehow healthcare has been regulated to like, oh, the doctor said I must have this, and that's all there is to it. Instead of it being like, here's what I get and here's how much I have to pay for it. So.
Yeah. Well, and there's obviously, it's a very complicated process there, and there's so many other hands in the pot from start to finish that, you know, really, when you look at, for example, the cost, somebody's having any sort of medical care, the cost of the overall healthcare dollars that are spent in this country that actually go to the physician is a very small percent.
Right.
You know, when you start factoring all the administrators, drugs, all these other things, what goes to the actual physician providing the care is a very small percentage of it.
Right. You see pharmacy care benefits and different programs where they're complete middlemen and don't do anything. But that is an interesting topic of scope creep. And it's fun, too, because it's offensive for everyone. You know, me as a nurse anesthetist or nurse practitioners, well, we were trained, but at the same time, yes, but do you have the expertise for what the patient needs?
Sure.
And there's certainly cases like the ER isn't a place to go get your expert opinion.
No.
In fact, most of our patients, we tell them, don't go to the ER, call us first and see if we can take care of whatever mental health or physical health crisis there is. And then if we can't, then go to the ER.
And that's true. And unfortunately, what I think has happened is, you know, the days have come and gone where you'd call your doctor first for most situations. Now, if you call many times, we're closed. If it's an emergency, go to the ER.
Or who are you?
Right, right. So I mean, I have always told patients, call me first before you go anywhere. So if you've had surgery and you're worried, you got a problem, call me first. Because number one, in many cases, there's not much going on that needs to be addressed. And if there is, and I do think you need to go to the emergency room so we can see it, usually I'm going to be involved in that, making sure if you need testing, you get the right testing. You don't just get any testing and have money spent that didn't need to be spent. And I think that's critical because, first of all, then it's our job to be taking care of the patient from start to finish, not just between 9 to 5.
Absolutely. And that's something where if you're not getting the care you need, whether it's from your PCP or from your specialist, that's something to consider. And I know we can't roll back the clock to, you know, back when you were in residency or because we talk about that often, how medicine used to be as opposed to the like assembly line that it is today.
Sure.
But it is something where like they should know you and they should know what your issues are and be able to take care of them.
Absolutely. And I mean, there's been a growth in an industry called concierge medicine, which is really a prepaid for like family practice or internal medicine where you'd prepay your doctor for the year a fee. And that fee would cover you for the whole year for your basic office visits, maybe even some blood work, things like that. And that model is still growing. It hasn't, you know, just become dominant, but it is still growing because it makes a lot of sense. You know, to really, when we look at what happens is if the patients know that they can get to their doctor and it doesn't cost them anything more, so even for a patient of mine post-op, if they know they can reach me versus going to the ER, when you factor all those things in, their outcomes are better, their costs are significantly lower, so you really want to encourage that, and unfortunately in a lot of areas that's kind of disappeared.
Right, yeah. And I think too, so if everyone's thinking, well, yeah, but doesn't all this cost money? A lot of the times the costs of insurance-based healthcare, and I know that at Ascend we take insurance, but I still like trashing insurance whenever I can, honestly. The costs aren't always visible. Like sometimes it's waiting 6 hours in an ER or waiting 2 hours to get back from your doctor, or the pain and suffering of waiting for someone to get back to you, or of course the wrong interventions. There was a time where there was a woman who had an absent seizure in a church, so I broke the seizure with a jaw thrust and then asked her about her medical history. I was like, oh, no, you probably shouldn't go to the ER. It was this extremely complicated history where it wasn't going to get any better or change any outcome.
Sure, that wasn't they weren't going to do anything except probably order a bunch of scans and then not be able to do anything. And at the end of a day in the hospital or ER, they would have said, okay, now go see a neurologist or a neuropsychiatrist.
Right, and plus add a couple CT scans in there for a good measure.
Yeah, so. Sure.
So if a patient is interested in anything that you have, because obviously it's not only surgery, like you said, sometimes they'll start out with fillers or Botox or something. What's their first step?
First step is call the office, have a consultation. Jessica who is my aesthetic coordinator, does an amazing job. Even pre-visit, going over things with patients, trying to get to understand what your goals are so you can make the right appointment, because you don't want somebody coming in for Botox that really wants a breast augmentation. Yeah. So we want to make sure the appointment's right, and then you come in, we go through a consultation process. I spend the time with you, examine you, go through what I think are your best options. If I don't think there are options, I'll tell you. If I think there's better options that I don't offer, I'll even say, hey, there's something better that I don't do. I can probably give you a recommendation, and then we'll sit down. Jessica will go through pricing, scheduling, and if you need financing help, she does all that. And our goal is to have patients have an amazing experience that they couldn't have anywhere else.
Yeah, absolutely. And it's interesting too, because of everything you've said, I originally thought, we'll probably talk about plastic surgery for a minute and then get to some really good stuff about American healthcare. But everything you said is an analogy for how healthcare works, how it should work, and what people should expect, that you need to be with people who know you and will take care of you and understand what's going on with you. Not just an assembly line of, you paid your copay, okay, here's a medicine, try that, come back.
It makes a huge difference, and it goes back to my training days, and I was trained as a general surgeon first, and that's how I was trained. Didn't matter. The patient was your patient. You are my patient. I'm there for you 24/7. If you need referrals, I take care of it. If there's an issue with getting a test done, I take care of it. That's what it should be.
Right. Instead of, I think someone on the insurance side should maybe do something. So, and again, if you need any mental health needs at Ascend Health Center, we're just in Fairlawn. So it's 330-754-4844. We have therapists, psychiatry. For treatment-resistant depression, we have Spravato, ketamine, transcranial magnetic stimulation. But it's the same idea of that sometimes you need something and you need it now and it's important, and other times you can start out with something that isn't quite, okay, let's get 4 experts together and let's try something invasive. But it's all about knowing yourself and having that education of what do I really need and why do I want it. So,
absolutely.
Yeah. Well, thanks for being on the show.
Thanks for having me.
You're welcome.
You are watching WCTV, Wadsworth Community Television.